Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA Finley.
It's been quite a morning, but now I really want you to meet Cheri Surloff. Cheri, I don't know, you haven't been on my show very often, have you? You've done the Cure Symposiums, but...
Yes, the symposiums, but not the radio.
Yeah, this is great to have you here. And you did such a great job with the medical marijuana at the Palm Beach, when we did the Palm Beach Civic Association. People were just drooling. They wanted so much more information, but we only had 25 minutes to go through it. You know, everybody now, it's a big deal with medical marijuana. It's, and yet now there's another, you ought to talk about the differences. There is a kind that you can get at stores, or there's a kind you have to go to a doctor for. Why don't you go through that?
Well, I think the issue with marijuana, unfortunately, has been that people that wanted to do research with marijuana and medical syndromes met with difficulty because there was this stigma that you have a component to the marijuana that can make you high and you're quote unquote a pothead. And it was associated with drugs that were not beneficial to the body, which is odd because in our society, there's not a time, especially when I was growing up, that you didn't see cigarette ads where people were smoking and joking and they were paired with, people frolicking by a lake, having fun smoking. And people, of course, the liquor industry is very powerful as the tobacco industry is in our country. So that is a real dichotomy. But I am a neuropsychologist and I have a degree in psychopharmacology. And when I speak about medical marijuana, I have such a passion for it because of the suffering that I have witnessed and the effects that medical marijuana can have on that suffering. And that, to me, is really the crucial issue. We know that we can have strains of marijuana that can be produced and provided to individuals that may have benefit, just as the ones that have a THC or the psychoactive component. We don't know yet. The truth is the federal government and the states can't agree where we can have the kinds of rigor and clinical trials that we need to give people the benefit of what we can provide. Let me just share with you something close to my heart. I suppose we as human beings create stories from the beginning of man communicating. And I think it's when we have a story or an ability to understand because of an individual what medical marijuana can mean. I don't know how many of you remember, it was several years ago, a young girl had a glioblastoma, and she was in People magazine because she had elected to commit suicide at 25 because she didn't want to live through the ordeal and the horror of dying slowly with this glioblastoma. I've been on the medical advisory board of the Brain Tumor Association for over 20 years, and I've lost people that I've loved greatly in my groups. We become a brain tumor really family as opposed to just support groups. And I went to Oregon where they had a 5-day symposium, and one day was strictly for physicians and research. And one of the researchers that presented was a group from Israel, and they had been using vapor in the particular dose that they felt was required given their study. And they were not only minimizing, but they claimed they were eradicating glioblastomas. If you recall, this is the type of tumor that McCain has. This is the tumor that killed Ted Kennedy. It is a tumor that it's almost like an octopus. It's not in just one area. It really can't be removed. There are neurosurgical interventions and chemotherapy, but ultimately, in almost everyone, it is a death sentence. I sat there and I listened to information that was never provided to me or to any of the people in my group, and they put on symposiums once a year where people that are really the great neurosurgeons and the researchers in our country, we went up to NIH, never did anybody mention marijuana. I had to go to Oregon to hear that. And that really was a wake-up call for me, that there is information out there that, one, our researchers aren't able yet to conduct clinical trials. When I was in Colorado, I went to a few dispensaries, and they were able to align with practitioners of all different denominations, physicians, and then they were able to locate the areas where these trials were going to be conducted and have some sort of continuity where we could lay the framework to look at what works and what works best. A lot of what we have now is just anecdotal. I teach at Florida Atlantic University, and I teach psychopharmacology, and I've had several of my students who have done tours in Afghanistan and various other tours and came back with significant psychological issues, let alone physical issues that some of them sustained. But the common thread was, I went to the VA, I was given a myriad of medications, psychotropic medications, mood stablers, antipsychotic medication, the atypicals to improve mood, antidepressants. I was given anxiolytics. I stopped everything and I started to smoke marijuana, and I'm in school now, Dr. Surloff. I'm in your class. I want to graduate. I couldn't do any of that without the marijuana. Then I have other students who come up to me and say, I had to go on the street and get marijuana for my grandmother who can't keep food down. She's going through chemotherapy and she can't eat and she can't sleep. And I said, Grandma, please try this. And she says, but I don't smoke pot. And I said, yes, you do now. And that was the only thing that helped. And I can't tell you, I've heard countless people tell me this that have gone through a cancer treatment. I was on a plane flying to Washington, and a woman was knitting, and a woman maybe 75, and she was knitting next to me, and I was reading a book on medical marijuana, and she turned to me, and I'm thinking, well, I wonder what she thinks why I'm reading this book. And she said, that's the only thing that helped me. I would have never gotten through my cancer treatment without that. And I thought, my God, the people of Florida have spoken. I am a proponent of medical marijuana because I have seen people die, and I have seen people die in a very unfortunate and painful way. I'd like to just tell you a story that it'll always live in my memory. I was always I was at Memorial Regional for many years. I was director of neuropsychology there, and the nurses would always call me during the day and say, hey, Doc, would you come over here, please? I've got a problem. And one of the nurses called me, and she said, I want you to see this particular person. He's very agitated. He's dying. And I thought, hospitals don't like to really talk about dying. And when I went in his room, he was agitated and he was crying, and he told me how afraid he was to die. And he and I spent the afternoon together. And when I went to this conference in Oregon, another group of researchers had researched and taken videos of people in hospice and in nursing homes. And I don't think there was a dry eye in the house. This was at the end of the symposium. And I was able to see people that were on the verge of death participating in that experience. Eric Erickson, one of our most beloved psychologists, wrote about the end stage of life, where we integrate and we try to create meaning with what we have done throughout our life. And people were able to do that, sitting up and participating, not zoned out on some medication or lying in a bed, where people are turning them constantly to avoid bed sores, but really to have death as part of life and part of our passion and part of our purpose. And the other issue was hospice, where people in hospice could spend the time that they had to interact with family and people that they loved and friends and not be anxious and afraid.
And zonked out that's what they do with them. I'm going to just hold you back for a minute because I want to make this clear. We keep talking about medical marijuana, but there's something, a lot of people do not want to smoke marijuana, and they don't have to now because there are a lot of other things. Can you go through some of the other ways now? People who are listening, they can actually go to stores that are advertising, and it isn't the medical marijuana, but apparently it still has great benefits.
Yes. In fact, I was speaking to someone from Colorado who grows hemp with extremely low psychoactive component, the THC, and veterinarians were using this on animals, and they were finding that these animals that had such disability from rheumatoid arthritis or from other immune diseases were actually getting better without any of the psychoactive. As far as the method that we will have to disperse medical marijuana within the body, certainly it can be done with vapor, it can be done with suppositories, it can be done in pill form. I think the issue really is what strain will be best for what, and that you can remove the psychoactive component. The question is, can you titrate the psychoactive component also for people that may have anxiety or people that may need to have a bit of that? We're at too early a stage to talk about this, but I would like to say something about medical marijuana that I found really unbelievable when I first discovered it. How can this substance we call marijuana affect so many different symptomatology and areas of the brain? Well, we have a natural endocannabinoid system in our body, just as we have stem cells that know where to migrate when there's injury to the body. This endocannabinoid system involves all of the areas for inflammation, for areas that deal with pain, for areas that are irritated or that have bony nerve inflammation. It helps with epilepsy. It helps with glaucoma. It can help with alcohol withdrawal. It can be a hypnotic. It can help with arteriosclerosis. And I'm thinking, what is this? Is this snake oil? I hear a researcher talking about how it's used for multiple sclerosis. Then I hear someone, a rheumatoid arthritis physician who specializes in that, said people that couldn't walk, that were just completely crippled by the disease, are walking out and asking, "Doc, can I play tennis?" And I said, what is this? This is not a snake oil. There is something to this that if we can harness, we didn't know that we had stem cells. And I tell my students, the miracle is endogenous, not exogenous, which means it's within ourselves, only we never looked within. It's only really recently that we recognize the power that stem cells can have. We haven't really been able to research stem cells the way we might because of the same stigma that we have with marijuana.
And, Cheri, I'm glad you're bringing that up, but I want to just say that I've had to really research some of this, and I found, and you knew this, that this whole hemp has been used. Ancient colonies have been using this. They always used hemp, and this isn't really new. And they have the ancients, the Greeks, the Romans, even far back. So now it's just like we're catching up.
Exactly. And, you get even more esoteric, and you believe that the earth is an aquarium and that we're extraterrestrial. If we really want to get out there, we say they left it here for us. But it's certainly whoever left it here, whatever divine presence, you or energy you believe in. This is almost a substance that has what years ago would be thought to be magical properties. And the shame of it is that it has had it. This makes me particularly angry that there should be a stigma which prevents it from being identified the way we can now with the tools that we have. We have functional imaging now and functional MRIs, functional PET scans, where we can actually see what this can do to the body and to the brain. And of course, the brain and the body are one, and we know how important gut flora is to the brain and to the body. So we know that when we affect this system that is a natural system, we can exercise a very powerful consequences that can be not only life-saving, but provide a much better quality of life. So when we talk about medical marijuana, we hope that it's understood that this is something to relieve suffering. And we see that the constituents of Florida have stood up and said, it's enough. This is silly. Let's look at this and let's see what it can do. And I think we're in our infancy with this. And I think that as all pharmaceutical agents ultimately, become more well-known and then recognized for the side effects many times in a drug are used for that particular purpose. We had ANITA had a most interesting immunologist and a geneticist at our last symposium, and he was describing metformin, which is a drug that's used for diabetes, and how they're looking at the side effect profile may help with anti-aging. So, we don't know what substances can do until we're able to have the proper kind of clinical studies done. And that is really what I'd like to impress upon everyone, because, you have a voice. And if it weren't for the people in Florida, we wouldn't have the ability to use medical marijuana as we can now.
So, Cheri, what I want to do, though, is say to everyone, because we had that at that symposium where they said, okay, I have to have an MD, a medical marijuana physician, to be able to prescribe this. And they asked me where they could go. Well, one person that we know, Dr. Merson, who is a physiatrist, but she's an MD, and she actually has been she's a pain medicine doctor, that's what they call her, but she's been doing all sorts of things, physical therapy, other kinds of methods. But now she is able, if you go there, and she believes that the medical marijuana will help you, she'll be able to prescribe it. But unless a doctor has been trained and certified in this, they can't. So for those of you who wanted to know who you could go to in Delray Beach, Dr. Merson, Merson, I believe her first name is Marcy. If you go there, she will help you, but it doesn't necessarily, so you need to be very careful. All doctors cannot prescribe this, and medical marijuana may not be necessary for you. You may be able to have what you were talking about, the other, which is the hemp, but in different forms, hemp oil. So, this, as you said, Marcy, so well, this is really all new, and everyone's learning. And that's why Boomer Times is here, because we're having people talk on the radio. We're going to have articles on it. But I love what you say. You don't have to go maybe through some of this, the horror of some of this terrible, the medications that just put you into another world.
Right. I think what ANITA has told you is really priceless, because certainly all doctors are not created equal, and this is a new field, and it's the same really when you go to a psychiatrist to give you psychotropics. He has a different expertise, let's say, than a general practitioner who will prescribe the same psychotropic to everyone. And I once saw one that was giving Paxil as an antidepressant. I said, why do you use that? He says, that's what I get from the rep. That's all I know. So, you have someone in a physiatrist who has seen the worst of the worst, because they are provided with people after surgery that need rehabilitation, or people that are resistant to being rehabilitated, or people with chronic pain. This is when I heard her lecture, and I was so impressed, and I work with physiatrists all the time, and she was so knowledgeable, not only about marijuana, but she was so knowledgeable about the different syndromes that would be applicable to medical marijuana. I'd like to just talk about something ANITA mentioned about the hemp. There are certain receptors that don't have anything to do with the psychotropic or the getting high factor in marijuana, if you want to call it that. The C1R is I've been isolated in trials, not maybe the trials that we're going to see in the future, but we know that it increases sleep and appetite. It stops a lot of sympathetic activity or activation. You'll say, what is sympathetic? Your sympathetic nervous system is your fight or flight. And you can imagine if you come back, let's say, with post-traumatic stress from, in my day, it was Vietnam, and now, you have people coming back, let's say from Afghanistan, that doesn't stop. What happens is the HPA axis gets altered. That's the hypothalamus, the pituitary, and the adrenal glands. And in just layman language, you're ready to fight and you're ready to be frightened at a moment's notice, or even thinking of something reinvents it, which is the horror of post-traumatic stress, because it kind of is circular. It reinvents itself. So it also stops the perception of pain. It reduces fear and anxiety, and it maintains a capacity for pleasure. And that's maybe what my young people are telling me. Doc, I'm alive again. I want to go back to school. I'm doing things I didn't do. I'm not isolated in my room anymore. CB2R is more for inflammation or immune function. And every moment of our waking, sleeping of life, we are warding off cancer cells, and your body is a microcosm at war and always trying to create a homeostasis and keep you alive and healthy. And that's why eating healthy, exercising, reducing stress, sleeping is such an important factor. If you don't get 7 to 8 hours of sleep, and I know when I was in the hospital, sometimes 15, 18 hours, truly in a day, I was sleep deprived for I don't know how many years. And it is a terrible thing to do to your immune system.
I have to tell you something. I have you on Facebook Live, and Linda Sauget is now watching.
But I'm so happy that we as a state have taken a stand with this, and I hope in the future that, I will be seeing more clinical trials for my patients to benefit from, and we can relieve not only some of the disease. The irony of this is that we are not only treating the underpinnings of disease, which is inflammation and the immune cell function, but we can also treat the symptomatology of that, which is the pain and the side effects of the disease process. So it's a twofold weapon to increase longevity and to increase one's well-being.
So, Cheri, so let me just say that it's an anecdotal story, but I heard someone got some of the oil, the hemp oil, and his wife's shoulders, they had some pain. So her husband was using the oil on her shoulders, and after 2 weeks she said, well, I don't know if it's so great, but he felt wonderful because it was, the oil was
getting absorbed.
Exactly. So you have to, it is easily absorbed. And I was looking at this one store. It's called the, Synergy, Health Synergy. It's in Boca Raton. And people were coming in and out. They have now gummies. They have, all sorts of, I had some taffy they gave me. And I didn't feel anything, but there's so much there now. And then there's things you put under your tongue. And so this is not smoking it. This is doing it very differently. They now have it, and I think in shampoo they have it everywhere. And it is homeostasis is a very important word that you used. It's going to go where it's needed. That's the big thing.
Yeah, it's a miracle and a marvel. And I think the moment we stop being surprised by the miracle and marvels of life, we probably are on our way out. But this is truly amazing. And I think that the tragedy of the young girl who committed suicide because she gave up hope with her glioblastoma was really a metaphor for what we cannot do, because we are now looking at the entire genome. Diseases will be treated, altering genetic mishaps and genetic missequencing. And now, we have a tool that can help us in so many ways. And I just want to leave you with the one comment that don't let some stigma affect the ability for us to harness this powerful medicine that we can provide. I know that people that hunt and smoke and drink will come down on marijuana, and we all have the right to our own beliefs, but to prejudice people against something that can be so powerful and so helpful to us and really life-giving, we all have to just look at the research and look at the clinical trials, and that will tell us. I mean, we should be open to what we can be given if they are allowed to do them.
I was thinking about the VA and all these guys coming back, and if they just, you can see when the VA starts allowing people to use the hemp, that'll be the day, right?
That'll be the day they won't need so many doctors in the VA.
But when you think about it, you know, hemp, I was buying hemp bread. I actually have hemp seeds that I put in my shakes.
Right.
I mean, it's just people need to really look this up. Go on Google, look up hemp, look up marijuana, look up medical marijuana. You will learn so much. It is confusing, and you've done a great job this morning of helping. It's a good beginning for people to understand, because you are such a kind person, and you do want to help your patients, and you see this as the new answer, don't you?
Well, I see it as certainly an adjunct to what we're using. The problem with what we use is there is no drug that doesn't have a side effect. And some of the side effects are quite debilitating or dangerous over the long haul. And the thing is, if we can use something that would take the place of a myriad of drugs or a potpourri of drugs that people may be on, because it's working. It may be working in terms of whether or not people have anxiety disorders or depression, but we may be able to find something that is healthier with less side effects. So the side effect profile really determines why we use many of the drugs that we do, because of the symptomatology. So we really need to investigate this, and I'm so hopeful that, people, you look at the grandma that was on the plane with me, who said, "Oh, I wouldn't have gotten through this without the medical marijuana." So she found a way to smoke marijuana when she was having this terrible ordeal that she had with cancer, the cancer treatment. So we will find a way, and people will have their voice heard, because when you are a legislator or you're someone who's against medical marijuana and you have chemotherapy yourself and you are in the bathroom vomiting endlessly, you may change your opinion about what we need to look at to relieve human suffering.
So, Cheri, this has been great. I just have to tell everybody, if you want, though, to get a hold of Cheri, I mean, I guess we can do that, because you're, let's just give your phone number out here. I mean, I don't know what you want. This is for people who, you don't want them calling you for this, but
you can call for anything. I'm happy to talk to anyone.
Oh, my God.
My cell is 954-551-1346, and I'm available 24/7.
Yeah, this woman, yeah.
You can call me, and I'm happy to talk to anyone, and I hope to learn as much from you as you might ask of me.
Thank you so much.
Thank you.